Hello, welcome back. Adam Rosen here. Thanks for listening to my channel. If you haven't already, please subscribe down below. You can click the thumbs up button if you like the information and click the little bell button, which will remind you when a new video does come up. So today, I want to just answer some of the questions that people have commonly around the time of surgery, and that is about icing. Should I ice? Do I need to ice? How often should I ice? Do I need an ice machine, or what way would you ice the knee? So, old-fashioned way, old Popeye, cartoons and slap a steak on your eye because you got punched, frozen peas. Still, a lot of patients use that. So there are other ways that you might use cold therapy to improve your knee after surgery. So number one, old-fashioned ice. You can take ice, you can stick it in a Ziploc freezer bag, put it on your knee. Super, super simple. Another option, which some patients like to use, are these reusable packs. These are packs that are filled usually with some type of bead or seeds that you can throw in the freezer, leave cold, and then bring it out because it's ice cold. These are helpful in one way because I find that the weight of these, you can lay it on your knee, especially if your knee's bent and you're working on extension. So that's one way. This is from a brand called Relief Pack. I'll put that in the show notes. And the other common way that people will use these reusable things are the gel packs. You'll see these usually at a lot of sporting goods stores. They'll sell them by the coolers. So these are packs that you can throw in the freezer, and they're moldable, and then you can lay them on your knee. And again, when they warm up, throw them back so you can reuse these. The other option are ice machines. So people ask about these cryo machines or ice machines, and should they buy one, invest in one? Is it good? There's two types. So there's one, your sort of simple cryo machine. This is a cooler. You put ice in it, you put water in it, there's a tube, and it's attached to a membrane that will wrap around your knee, and that offers cold therapy. The second kind is almost the same, except it is pneumatic. So what it also does is it compresses the tissue around your knee, and the goal there of the device is to aid in more swelling control. So the big question is, do you need to use an ice machine? Do you need to invest in one? And the honest answer is, I don't know. There are a lot of studies, but no one has really done super good what we call level 1 evidence. These are the definitive tests that really study a question and answer beyond any reasonable doubt of it helps, it doesn't help, or there's no difference. Most of the studies are done in small centers or by companies that make the device, so there's a little bit of bias. What people do find with ice is ice can help pain, ice can help swelling, ice can help inflammation, it can constrict blood vessels around the knee, it can reduce the blood flow to muscles, which can cause edema or additional swelling. So all of those are good. Is there anything bad? Ice can cause an injury. So when you use ice, it can constrict the blood vessels, which can inhibit blood, which is important for healing. And there are instances where people use ice for too long, and you can actually get a frostbite type of injury, which can lead to skin problems. So that's a big deal. So icing in shorter intervals, especially with a barrier between the ice and the skin, is important. Ice directly on the skin or for a long period of time can cause damage. Now, my patients, if they want to invest in an ice machine, that's the big question. Should they? There's a vendor on site that does sell them. Insurances around here don't cover them. And again, insurances usually don't cover things if they're not proven to be of benefit. So without strong scientific evidence that proves it beyond a reasonable doubt, they will not shell out the money. I believe our vendor, it's $165 for the machine and the tubing and the pad for the knee. You can find these on Amazon. I've checked, and anywhere from the just above $100 up to $300. You can get these cryo machines with the pneumatic compression. That's in the $1,000 plus. So then somebody says, well, my neighbor has one, I'm going to use theirs. I'm not always sure that's a good idea. So if you have someone that's going to offer their ice machine to you, what I do strongly recommend is see if from the company you can buy a new pad. Most of the companies sell shoulder pads and hip pads and knee pads, depending on what body part you're icing. So you might be able to find a new pad because their bacteria might be different from your bacteria, and you don't want to take their bacteria and put it on your fresh surgical incision. Now, if you invest in an ice machine, I do see patients in the office that seem to have less pain, use less narcotic opioid, they tend to have less swelling, less inflamed looking tissue, better range of motion. Can I prove that the ice machine did it? I'm not sure. And that's the hard part with these studies. Most of the time, studies like this are looking at these subjective answers of, did the wound look normal, better than normal, worse than normal? Was the swelling average, better than average, worse than average? So it's really hard to put a definitive yes or no on it. But I do think if people invest in an ice machine, they tend to want to get the money out of the machine that they purchased. So they do tend to ice more frequently. And if they're icing more frequently, they're getting the benefit of icing or cryotherapy, whatever the way that you're getting it onto your knee, whether or not it's just a simple ice bag or the machine. So icing is important. When patients ask me where to start, I usually will say, 5 times a day for 5 to 10 minutes. Some people find that that's enough and they're doing great. Some people find they have more pain, inflammation, swelling. They might do it more frequently, or maybe 10 minutes is uncomfortable, so they only do it 5. So you need to figure out what works best for you. So icing, yes, super helpful after surgery. Downside is you do not want to ice on the skin, which can cause a wound complication. The way in which you ice, whether or not you use a simple ice bag, some type of reusable device, or an ice machine, completely becomes up to you, but icing should help. Hope this answers the questions. Can't give you always the definitive yes or no, but this one at least will answer the question that I'm sure many of you have. So good luck with your recovery. Until next time, I'm Adam Rosen. Stay safe.